Hello everyone. So today's topic is chicken pox. Okay. So in Hindi, this term is known as Choti Mata, based on a Hindu goddess that Hindus worship, considering this as a curse of their goddess. So, going directly into epidemiological determinants of chickenpox, talking about the agent factor, the causative organism is varicella zoster virus or the human herpes virus 3, that is that belongs to alpha category, that causes chickenpox. Now there is a stark difference between chickenpox and varicella zoster. Okay, the chickenpox is a condition that is a primary infection from varicella zoster virus, whereas varicella zoster is the reactivation of the disease which lies latent within the organism, within the man. As you are seeing in this image, we are seeing that the disease has reactivated from the sensory ganglion. This disease has spread to the thoracic dermatome, and we are seeing a clear rash over there. And the difference is that when the patient develops a secondary infection, that is more severe, and there are more chances of complications. Now, all the clinical features that we are going to study are seen both in chickenpox and varicella zoster, but the severity of these clinical feature is more in the case of varicella zoster. So, the second thing we need to know is that the source of infection is always a case of chickenpox or varicella zoster. Now, these sources uh, transmit this infection either through droplet or droplet nuclei. So, this is a respiratory infection through the oropharyngeal secretion or nasal secretions. The droplet or droplet nuclei spread the infection, chickenpox. One more thing that we need to know is that when the case develops the scabs, okay, the stage is non-infective. The period of communicability is 1 to 2 days before the origin of rash and 4 to 5 days after the rash has developed. So this is the period of communicability. We need to remember that the secondary attack rate is very high, that is 90%, and this is why isolation becomes very important in the case of chickenpox. The other things we need to know about host factor is that the age in which it occurs is usually less than 10 years, but it can occur in later ages also. Uh, when the patient escapes the infection within 10 years, and when again the patient develops the infection in adulthood, that is more severe. The immunity we need to remember here about immunity is that here the cell mediated immunity plays a vital role. As we know, with age the cell mediated immunity diminishes, and this is the reason the chickenpox cases become more severe with age. And the child, when it is born, it receives IgG from the mother, and this is why it is saved 6 months from the infection of chickenpox. In pregnancy, okay, when a female who is less than 20 weeks pregnant develops the infection of chickenpox, she can suffer from congenital varicella syndrome. Now, when the female suffers from congenital varicella syndrome, the baby may be born with various deformities like microcephaly, the congenital cataract, the low birth weight, and other abnormalities. The environmental factor, we need to remember that this disease occurs in winter and spring and in the coolest and driest of months. Let's talk about incubation period of chickenpox, that is 7 to 21 days. Going on with clinical features of chickenpox, there is a pre-eruptive stage and an eruptive stage. So this pre-eruptive stage lasts for less than 24 hours. Exception is in adults where it may remain for 2 to 3 days. Now in this pre-eruptive stage, patient presents with fever, back pain, shivering, and malaise. He may also have vomiting. So this is what happens in pre-eruptive stage, and this stage is followed by eruptive stage, which is characterized by rash. And this is what is the most important part we need to remember. The the four things we need to remember about rash is its distribution, its evolution, its pleomorphism, and relation with fever. Let's see diagram for distribution. As you are watching in this photo, compared to the case of a smallpox, the chickenpox lesions that are the rashes are more concentrated towards the trunk region, means in the chest and the thoracic part, and less over the peripheries, and these are rarely found over the soles and the palms, contrary to the case of smallpox. So this is what we needed to know about distribution. The second thing is its rapid evolution. By rapid evolution, we mean the macule stage, papule stage, the vesicle stage, and the pustule. This is how the rash progresses. But this progression is so fast that we are not able to notice them, and generally the patient himself notices directly the vesicles, and these vesicles, as you are seeing in the image, give a dewdrop appearance compared to a dewdrop fallen on a leaf, as you are seeing. The third thing we need to know is pleomorphism. Now, by here pleomorphism, we mean that all the stages of rashes, that is papule, macule, vesicle, can be noticed simultaneously on a patient. This is because of different areas that have different stages progressing over the rash. The fourth thing is the relation with fever. Now, when there is a new crop of rashes growing, we see that there is a spike in fever. So, these were the four things that we need to remember about the rash: its distribution, uh, that is in the trunk, the rapid evolution, dewdrop appearance, the pleomorphism, all stages simultaneously, and fever that occurs in a spike after the crop of rashes. Now let's talk about complications of chickenpox. The most common complication, the most commonly these complications are seen in the case of varicella zoster, means a secondary infection there. Now the most common cutaneous complication seen here is secondary infection of skin. Okay, and the causative organism is Staph epidermidis or Staph aureus. The most common extracutaneous complication is acute cerebellar ataxia. Okay, the most common extracutaneous complication is acute cerebellar ataxia, and the most common complication seen in the case of adult neonate, and this is the most deadliest of complication that can occur in chickenpox, is pneumonia, that is varicella pneumonia. Now, when we diagnose this condition, generally we diagnose it with a PCR of by detecting varicella zoster virus DNA. Prevention is we have to isolate a patient for a period of 6 days, as we know that the rash that occurs has a period of communicability of 5 to 7 days, 4 to 5 days after the rash appears. Okay, so we have to do isolation, and we need to remember that acyclovir, valcyclovir, these are drugs of choice while we are doing prevention of chickenpox. Acyclovir becomes more important because it not only decreases the development of systemic disease in the case of varicella, but it also halts the progression of zoster in adults. The next thing we need to remember is about prophylaxis with immunoglobulins, varicella zoster immunoglobulins, and the vaccine that we use in the case of chickenpox. So the immunoglobulins that we use are to be used in the case of exposed person to chickenpox, but we need to remember that patients should be susceptible, means he should be a high risk patient. So either a patient is immunosuppressant, or the patient is a low birth weight baby, or patient is already having some comorbidity like HIV, or the patient has a congenital cellular immunodeficiency. So these patients, when exposed to chickenpox, need to given varicella zoster immunoglobulin intramuscularly 12.5 units per kg of body weight, and repeat this dose within 3 weeks. Sorry, after 3 weeks. So this is the immunoglobulin that we use. Now the vaccine that we use in the case of chickenpox is a Oka strain, and this is a live attenuated vaccine. Since this is a live attenuated vaccine, it is contraindicated in immunocompromised and pregnant. Now also, because this is prepared with it is pre-treated with neomycin, it is also contraindicated with in neomycin allergic patient. Now the it is given during 12 to 18 month of a child age, or if it is an adult with a age more than 30 years, two doses are to be given, and the period of protection is around 10 years. There are some adverse effects, though not so severe. 25% of patients may develop tenderness and erythema over site of injection. Contraindication we have already discussed, and this is the thing we need to remember at last is that we need to remember that we have to avoid salicylates, means aspirin along, in the case for 6 weeks, because the patient may develop Reye syndrome. So this is what is chickenpox. Thanks for watching.